Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Differences between Kwashiorkor and Marasmus. In Kwashiorkor, there is pitting edema is seen and wasting is also present. Whereas in Kwashiorkor, there is severe wasting or no edema is seen in Marasmus. In Kwashiorkor, there is pitting edema and wasting is seen. In Marasmus, there is no edema, but there is severe wasting is seen in Marasmus. Kwashiorkor shows fat sugar baby appearance or moon faces are seen in Kwashiorkor. In Marasmus, there is monkey faces or boggy pant appearance are seen, along with wrinkles are seen in the gluteal region in the Marasmus. In Kwashiorkor, the child is apathic and irritable, whereas in Marasmus, the child is alert. In Kwashiorkor, the child has poor appetite, anorexia, thus it is responsible for poor prognosis, whereas in Marasmus, the child has voracious appetite. In Kwashiorkor is a type of non-adaptive malnutrition. Marasmus is a type of adaptive malnutrition. In Kwashiorkor, the hair is lustreless. There is loss of temporal and occipital hair. Hair is easily pluckable. Alteration of hypo and hyperpigmentation is seen, which shows plague sign. In Kwashiorkor, the skin signs include crazy pavement dermatosis and flaky paint dermatosis. Severe acute mal. So in Kwashiorkor, we have skin signs like crazy pavement dermatosis and flaky paint dermatosis.
thank you and thank you for watching.